As promised earlier, today we will be discussing the core concepts of obstetrics, and we will start with small things. So first and foremost is concept of how a fetus is presenting itself in the uterus. So during or nearing term pregnancy, it is very important for any student, postgraduate, undergraduate, consultant to know how fetus is lying inside the uterus, because ultimately that will decide how we will terminate, when we will terminate, what should be the mode of delivery. If she goes into spontaneous labor, what is the precaution that we should be taking care? The lie of the fetus, and lie of the fetus has no relation with abdomen, that contour, but it is a relationship between the, say, long axis of the mother, which is spine. Suppose this is lumbosacral spine, and long axis of the fetus. We suppose this smaller pen is fetus. So this relationship, whether it is parallel, it is perpendicular, or it is oblique, this relationship is known as lie. So suppose this is uterus and this is maternal spine, and if fetus and his spine or her spine is parallel, it means that this lie is longitudinal. Longitudinal with respect to the long axis of the mother. That is point number one. Second is, if the fetal long axis, that is the spine of fetus, is lying perpendicular, then it is known as transverse lie. And third is, if they are oblique, then it is known as oblique lie. One interesting thing to note and remember is, obviously, the long axis of the mother will never change. It's going to be the same, that is maternal spine. It is the long axis of the fetus because it's a tiny small thing, 2.5 to 3 kg maybe. Like this, it is lie longitudinal. When it is lying like this, it is lie transverse, and when it is lying like this, it is lie oblique.